Hello and welcome to the Rogers TV COVID-19 show. I'm Carol Merton, and before I welcome our guest today, I'd like to share a few thoughts with you. We are at a critical juncture in our ability to contain the spread of COVID-19 and to protect our residents. Our hospitals in Grey Bruce are admitting very sick COVID-19 patients to the ICU beds, and our healthcare system in Ontario is being stretched to its limits. Hospital beds and ventilators are not an endless supply, and no one wants to think about what might happen should all of those beds and those ventilators be in use and more very sick patients arrive and need this specialized care. Our Grey Bruce Health Unit is the leading agency for the management of the COVID-19 emergency, and they can't do this alone. They need, and in fact are pleading with us to work together with them. We can all agree that we want to make this lockdown the very last one we will have to go through. Follow the provincial stay-at-home order by not going out except for absolutely essential travel. If you have any possible COVID-19 symptoms, go to the assessment clinics for testing. Be open and transparent about the people that you may have been in contact with. This might actually save their life and those of others. The Grey Bruce Health Unit asks the public to continue to practice the 3 W's. Watch your distance, wear a mask, wash your hands, and of course, stay home. This journey has been long, and we are all weary. The sacrifices that we continue to make each and every day will bring us all closer to the finish line. Let's make the difference together. Thank you to those in our community who are working together to end this pandemic. And on that note, I want to thank and welcome my guest today, Dr. Ian Arra from our Grey Bruce Public Health Unit. Dr. Arra is the Medical Officer of Health and the Chief Executive Officer for the Health Unit. Thank you so much for joining us today.
Thank you, Carol, for having me. It's always a pleasure to be here.
Thank you. I know it seems like we are always having new and fresh information from you, and I'm wondering where you'd like to begin. As always, I have questions, but I'm hoping I don't even need to ask them because I think you've got enough to carry on the program. So.
Guilty as charged. I wouldn't carry it as good as you do, so I'll definitely follow your lead. I have really positive, pleasant, and a celebration of success news to share with Grey Bruce. Last week, we raised a concern about a surge of over 70 cases within 36 hours, which is a very hard finding. And it was the threshold where our contact tracing could be challenged, a threshold that is very important. Other health units came to it last September, last fall, and many of them just didn't persevere for many reasons, whether it's the engagement from the community or the situation at hand or the capacity. For us in Grey Bruce, we raised the alarm, and to my delight, everybody delivered over and beyond. The public stayed the course. Municipalities, businesses went over and beyond in closing business to model the way for people to say, this is serious, let's do it together. This gave us a period of time, a window of time of around 2 to 3 days, and that was sufficient for us to readjust our processes and deploy our contingency plan on 2 fronts, the vaccine front and the contact tracing front. For contact tracing, we redeployed staff from other programs, and we broke down the process of contact tracing to different assignments. So the easier ones, the initial call to say, stay at home, you are a case, was done by the less experienced staff from other programs. The investigators, the core program, took care of the risk assessment, which is a very complex process to ensure that people who are exposed and the people who are exposed to them, and the people who are exposed to the third layer, all of them covered in 3 days. And we were successful in reaching the level we needed. The numbers showed decrease over the past few days, and I have no doubt in my mind we're going to see an increase, a little surge after a week to 2 weeks from the initial one, just because people who were exposed carry the virus. It's inevitable they're going to be converting to a case. However, converting a case in isolation is a safe scenario where there wouldn't be secondary or tertiary transmission. So that's on contact tracing front. We use certain technologies that were used in healthiness like Peel, that process development and virtual contact tracing. The province was on standby behind us, and they have a pool of contact tracers, but we do things a bit more rigorously here. So I didn't want to mix two processes unless we had to. So that is a great success on its own to actually reach that threshold and turn the ship. This success is augmented, and this success for all Grey Bros, for everyone who's listening to us, business, person, organization, and the media, included. I mentioned it before. This whole buy-in would not happen without a mature media that is intentionally focusing on COVID. The second part of the success, Carol, is related to vaccine deployment. So we had plans to complete the school sector within the April break. And that's a strategic time to complete it in case people got side effects from the vaccine. That's not going to cause the schools to lose employees for that period. Nevertheless, with this surge, we know that the people who are working in schools are not working in schools because they're closed. So there isn't really increased risk if we defer it for one more week. But the people who are in shelters, in community living, those are the most vulnerable. So we decided to redirect 1,000 plus vaccines from one clinic that was planned, not booked, not scheduled. Nobody lost their appointment. From the school sector, those vaccines were redirected to provide the vaccine to a total of 42 shelters and community living across Grey Bruce. And that was done over 4 days, the weekend and Monday and a bit of Tuesday. So you can see how a challenge is not just being met, rather turned into an opportunity to complete that vulnerable sector a bit earlier.
Excellent. So just a couple of questions. I did warn you, I might have a few questions along the way. So in 2 or 3 weeks, you mentioned you're anticipating, just the way the virus is and the contacts, that there may be another surge, site surge. The message is not that the stay-at-home isn't working, it's that it takes time for the contacts and the high risk for the picture to become more evident. So people shouldn't think, oh, gee, it's not working, I might as well do other things. The message is it is working, but it takes time to get through this process. Have I understood that right?
Yes, in principle, definitely. The surge that we'll see will happen later this week, and we might have already seen it yesterday with 16 cases, and can happen next week. Okay. It's 1 to 2 weeks after the exposure. The variance is a wild card, right? Because their transmission is really quick, so you might see the surge a bit earlier. Nevertheless, if we have the same robustness in our response as a community, we are able to go down to a baseline that is manageable during the summer. There is seasonality to these viruses and pandemic, Carol. And you look at last year's wave, it peaked mid-April, went down, and Grey Bruce was almost to a baseline by the end of April. This is probably the trajectory of this wave as well. And I mentioned this about 4 weeks ago on multiple occasions. The variant is a wild card. It can make it a bit longer. It might make it steeper. Nevertheless, I do believe in our community. The confidence earned or built through the response repeatedly to every juncture. We opened schools. We closed certain sectors. The public in Grey Bruce has always responded. And like you rightly said, we're not out of the woods yet. We need to stay the course. The vaccine is around the corner. the bigger shipments, and that will be the last wave. I hope we have. There's no reason there should be another wave there.
Yeah. You mentioned in other conversations that I've had, and certainly with businesses, we use the word pivot, but what you've described as far as this most recent contact tracing demand is how the health unit has actually pivoted on their tiptoes, I'm sure, to be able to address this urgent need, just like we've asked businesses and everyone else, and it's remarkable that they've been able to do this in 2 or 3 days to get a handle on those contacts. But it also means that for them to do that, they have to leave their regular portfolios. And so the public can help by following the guidelines so that we're able to get people back to functioning within the portfolios and not have to be pulled away. And certainly, I think that's how we can help the health unit help us.
Yeah, definitely. Everybody can help in many ways directly by practicing the 3 W's and protecting ourselves, our families, reduce the risk of getting us become a case, and utilizing the system, the healthcare system or public health. That's one way. The other way is to be informed. All the information people need is on our website, and sometimes we get repeatedly this question: where can I book the vaccine? And it's literally on the first page on our website. So spending a couple minutes to learn about the vaccine for a few days really would make that decision to get the vaccine is more informed, would allow the person to be more comfortable with their knowledge about the pandemic, and reduce the demand on the health unit staff and the healthcare system as well. You touch base on a really important point, Carol, which is management during emergency. During non-emergency, we know that efficiency and stability are virtues. In emergency, pivoting from a program to a program is not just a virtue, it is necessity, inevitable. One example, in the first wave, all restaurants are closed. So now you have a team of 15 public health inspectors who otherwise will be out there inspecting, have no work to do. So let's channel them to support contact tracing. So that you change the structure of the management and the reporting. Then when the wave ends in April, and in May, all these restaurants opened. Usually an inspector will inspect 2 or 3 restaurants per day, but now everybody needs that inspection today to open. Right. So you need to move people from contact tracing back to in public health inspector work, and add a bit more from other program. Then you go to school opening, and you need more nurses in schools. So the nurses who are doing the vaccine will be there. Then you open the vaccine when the vaccine arrived. So you move people back. Shifting portfolio in the health unit is definitely clear indication of resilience and good management to ensure that the different aspects of the emergencies that are happening frequently and sometimes you close one door, you have 2 doors open. To respond to all these things, changing management is definitely a virtue, is an art as well.
For sure. Being adaptable in any organization, especially in an emergency, is a skill, and it gets tested in an emergency situation. Being structured and rigid it's not as helpful. You need that. You need the ability to be fluid within the structure, and I think certainly you've discussed that absolutely. One of the things that we understand from previous conversations is that vaccine delivery now is in various spots. It's not just in one location now in Grey Bruce. And certainly I'd appreciate you speaking just so that people know, you know what, there are lots of choices out there now, as well as, different places. But also what was interesting to me in a previous program, I interviewed the paramedics, and I was absolutely delighted and amazed to hear the role that they are playing within this whole pandemic. And I'm wondering if you wouldn't mind mean, everyone's playing a part, but they really have an expanded role. And I'm wondering if you would mind discussing that as well.
Absolutely. Partners across Grey Bruce and different roles have played different instrumental roles. Paramedics and EMS services in Grey and Bruce have been indispensable, and that started early on, February 2020. February 2nd, the chief of EMS was sitting in this office here with myself, and I was saying we're going to have a pandemic on our hand, and the scope of practice will need to be expanded. And I had that conversation because he had the vision early on, 2 years before, to increase the scope of practice. So again, there's an opportunity there to actually utilize a bit more. Fast forward in May, the rest of the province following our lead to ensure that EMS services can test and swab, and that's a controlled act in medicine. It has to happen through a physician or nurse practitioner. So that was increased, and the medical directive from myself to EMS would allow them to do this. Later on, we planned for vaccine distribution or administration. And in the hubs and in the many clinics and in different settings, the paramedic would serve both to administer the vaccine and to be our life-saving service if in case there's an allergic reaction or so. And they bring a lot of a wealth of expertise in putting people at ease. Just the mere presence of a paramedic there would put people at ease. So those are a few things. There are way more other areas we collaborated on, but it has been just a pleasure and privilege to work with the EMS partners in Grey and Bruce.
Yes, I agree. As I say, I was delighted and just so impressed with what they could offer. But as you say, there's many partners. Can you talk about where people can get vaccinations?
So now we have 5 modalities in Grey Bruce. One of them is the hubs. We have 3 locations, and we have many hubs in different municipalities as well. We have primary care. We have a number of registered practices, over 6 I last saw, approved by the ministry to receive AstraZeneca, and they do their own registration. We support them with IPAC and the cold chain to ensure the vaccine is available. Pharmacists as well, they distribute AstraZeneca, and we have a list of 11 of them. I believe most of them have been approved. If not, next week they would. The First Nations have 2 community centers that they receive vaccine there. Mobile clinics and mobile teams, those are mainly EMS volunteers and public health, and those are the teams that distributed the vaccine to shelters and community living. There are multiple ways to receive the vaccine. All these ways, all these services will start by booking on our website under the provincial system if the person is booking based on age, or under our own system if it is based on phase 2 and essential service and people with comorbidities. And Carol, it's worth mentioning, we opened the clinic especially for people who are receiving chemotherapy. This group require the vaccine within a window of time between the chemotherapy, otherwise it wouldn't work. So the first dose and the second dose will be customized for their need. Whenever they need it, there is a clinic every Thursday, and we opened the same clinic as well, expanded it for, this week would be the first week, for pregnant women. VOCs are affecting younger adults, and many of them are more often than before ending on ventilators. And pregnancy is a complicated condition to start with if somebody required hospitalization, let alone ICU. So we have in Grey Bruce around 1,400 pregnancies per year or deliveries. So we adjusted the numbers, we calculated, we provide it every week, and we hope to ensure it's provided to everybody who wants it. Another pivot, the word pivot becomes normal in emergency. Our healthcare providers received the first dose in March within the provincial direction. Now, seeing that we're receiving transfers of hospitals from different hotspots to our hospitals, I see critical importance that they would receive the second dose, our healthcare providers' second dose immediately. And I will definitely make that case to the province. Hopefully, by 10 days from now, we can provide it to everybody and ensure that the hospital system is more protected for all of us, not just for the healthcare provider there.
Exactly. So I know, having attended Hanover Hub yesterday myself, that how efficiently it worked. I was so impressed. But the information sheet I received was that I shouldn't receive any other kinds of vaccinations for a period of time. Why would that be?
So this is not unique to COVID vaccine. It's usually for all vaccines. The way the vaccine works, it really doesn't add immunity to the body, or rather it elicits immunity. So it's a natural process in the body, similar to when a person gets a common cold, there's immunity built against it. And when this immunity is being built, if there is another vaccine to come in, that vaccine is not going to work because there is already immunity. So having a second vaccine right after this one, depending on the type of vaccine, it might be void and unnecessary, or not unnecessary. It would not work. There are usually a period of 15 days or so. After that, you can receive the vaccine.
Yeah. This may be a question that isn't answerable. I guess it might need a crystal ball, but needless to say, we were told early on we might get patients sent to us, and now the reality has happened. We have a field hospital here in Owen Sound. Are you concerned that we will have such overflow that we will need to utilize that field hospital? And if you're not comfortable answering, I totally understand.
It is, like you said, difficult to answer a question in the future. In this pandemic, you can answer about 2 weeks about cases in the future and about 4 weeks for hospitalization, just because it's a lagging indicator. We saw the 4,000 cases per day for the past few days. It is inevitable. It's going to be followed with increase in hospital admission and ICU admission for the coming 4 weeks. Like, this is already done. These people are going to be sick, and some of them are going to end up in the hospital, and another group, part of them is going to end up in the ICU on ventilator. So we know the system provincially has been challenged, and we know that there are transfers happening. So this is going to continue for a while. How much capacity our hospitals will be able to accommodate, I trust our system provincially, and I know firsthand, working with the CEOs from the hospital, they're prepared. So hopefully we would not need the Bayshore Field Hospital. Nevertheless, we are prepared to deploy it, and that's why you might see in the near future the hub in the Bayshore is going to be moved to another location in Owen Sound, and that would allow activation of the hospital to be overnight anytime they need it.
And I think, knowing, again, that goes back to the resilience and being fluid in the just-in-time planning that has to happen, because it doesn't sound as if there's a lot of notice when there's that overload situation. There's some critical decisions about who can be moved and who needs to stay, that you need the space set up and ready. So it certainly sounds like there's conversations around that. I looked at the most recent information you sent, because you do updates every day, and sometimes we get numerous updates, which is great because it keeps people informed. Situation report number 400. 400 reports, and the numbers keep going up. They are up and they're down. Would you ever have anticipated 400 reports that you would have to do at the beginning of this pandemic? And how many more, Dr. Arra? Crystal ball.
I don't know if the number 400 was on my mind. I knew in January 2020, we need to dust off our pandemic plan and we need to be prepared as much as we can. And we have been in Grey Bruce. The two counties and municipalities, the media, the public, everybody has delivered there. If you ask me in November, knowing the vaccine is in, or sorry, let me retract. In April, I spoke, I don't know if on this program or another program, about the vaccine being ready around the end of the year. And that's based on the scientific process. There's no prediction there. And the humanity as a species, we delivered. We developed that vaccine. So in November, December, when we heard about the vaccine being in sight and it's going to be approved and then approved, I did not imagine there was going to be a third wave, because I knew locally we have the ability, and now we demonstrated 3,500 vaccines per day in 10 hours through 5 vaccinators. That is, again, it might sound immodest to describe something I invented, but this is a game changer. And now every health unit that I connected with about it has been implementing this, over 6 of them, Manitoba, Alberta. So you have this in mind in November, that I know it's doable. I know the team is ready for it, that municipalities can support, and Bruce Power Chapman's already engaged. So with that in mind, I thought we were going to be done by March. And actually, given the supply of vaccine would allow it, we would have completed it in March. Unfortunately, the supply to Ontario in general has been reduced, to Canada in general has been reduced, or not reduced, has been modest. We remain ready, and hopefully we'll finish this in the near future. Did I predict 400? Not specifically. Did I predict it's going to be a long journey? Yes. It is actually like being in prison. Like you can't do anything. You're it, and you just have to stay the course. And I was interviewed by the museum, Roots Cray, and they had the story about the Spanish flu and how the MOH at the time finished the year or 2 years, and just he couldn't imagine doing the job anymore, although he was loved and supported by everybody. I hope I'm not going to be in that condition, but it feels like it's prison.
Well, let's hope that you don't repeat that pattern that the other MOH did. I want to thank you so much for being on the program. As always, the time goes by. Thank you for all that you do, and thank you to the staff for all that they do to help keep us safe. Thank you to our viewing audience for joining us. Please join us again to learn more about programs and services available to you and your family. Take care, stay safe, and please stay home. Thank you.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line. Email us or connect with us on social media.
What kind of show do you want to see on Rogers TV? What interests you? Log on to rogerstv.com, fill out a show proposal, and tell us about your segment idea. We want to know what you want to see. Rogers TV, only on Rogers.
Now you can enjoy the Amazon Prime Video app on Ignite TV. Just say Amazon Prime Video into your Ignite voice remote and watch Amazon originals like The Expanse.
They want her to fight. Won't give her